Hello everyone. In today's video, I'm gonna be discussing the topic ethical and legal considerations with nursing informatics. So nursing informatics is a specialty or discipline that deals with the conversion of data into information and then utilizes technology in different forms, whether it's electronic health record, mobile devices that we use in nursing practice to improve health outcome of patients, the quality. On the other hand, we talk about ethical and legal considerations with the use of this nursing informatics. When we talk about ethics, we are talking about moral principles or values. What some people will call maybe societal norm, what is acceptable to society in treating your fellow human beings, all those things you consider, you want to treat them, follow the golden rule. And then talking about the legal aspect, in every setting, there is always rules that apply, and those rules bring about decorum or organization. If there are no rules, there will be chaos. So even in the use of nursing informatics, there are still some rules. Even though the migration from paper sharding to electronic documentation is a positive step in the right direction, it has also brought a lot of challenges to nursing practice. We know about security concerns, hackers trying to steal information using malwares, using viruses, using phishing, scam, and all of that. And sometimes healthcare providers are not even aware of what is going on, and just a click can lead to the loss of information, patient information. And for this, being aware that there are rules or laws that apply that are out to protect patients' information, one will be pushed to be more careful. And again, for organizations and facilities, when are there measures, security measures in place to protect patients' information, including like educating the care providers, nurses, doctors on the best ways to use patient information to avoid compromise. Also, putting security measures in place to safeguard the data, patient's data. And again, while sharing information, are there rules within the organization on how data can be shared? Being ethical in our nursing practice actually makes us to protect the confidentiality and privacy of our patients. And this in turn builds a solid trust in our relationship with our patients. So bringing this to the topic at hand, which is considering the ethics and legal aspects in the use of nursing information, we can find the list of principles, ethical principles that nurses are supposed to abide by in the book Informatics and Nursing, Opportunities and Challenges by Miller KS 2025 on pages 15 to 17. You can find them there, and I'm going to run through some of the principles of nursing, ethical principles of nursing. Number one is autonomy. If we bring this to nursing informatics use, autonomy means it's about how we give our patients access to their own information as needed, and also letting them decide who should have access to their information and who should not. Then the second one is beneficence. In everything, beneficence is about doing what is in the best interest of our patients. When we use their information, do we actually use them in the way that it will benefit them and then avoid doing harm to them, which is the third ethical principle of non-maleficence. Do no harm. Do we use this information in a way that will not bring any harm to our patients? Number 4 should be veracity. Sometimes errors are bound to happen. Sometimes data is are compromised in organizations. When something like this happens, are we truthful to the patients? Do we let the patients know that something like this has happened, their information has been compromised, and also let them know the plans we have in place to towards recovery? And then we also have justice, treating all patients in a fair manner. Let me put it this way. Do we treat them fairly, each and every one of our patients? And then fidelity, being true to ourselves, being honest about who we are with our patients. Do we maintain that in our practice? And the last of all is respect. I mentioned earlier that being ethical leads to maintenance of or demands maintenance of confidentiality and privacy. Do we practice this with our patients? Even those at the end of life stage, do we still treat them with respect and human dignity? And even after they pass, do we treat their bodies the same way? With their information, do we always observe confidentiality and privacy? These are the ethics that are needed to be considered in the use of nursing informatics. And just like I mentioned earlier, in any setting, there should be rules that apply and rules that will bring organization and eliminate chaos. So with the use of nursing informatics, there are still some rules that are in place to guide its use and prevent abuse. And if you take a look at the article here by the Office of the Civil Rights, reference on this video, you will see that I talked about protection or health information privacy with respect to HIPAA. HIPAA is Health Insurance Portability and Accountability Act, enacted in 1996. And the purpose of HIPAA is to protect the personal health information of patients and as well promote the access patients have to their own information. So while we utilize nursing informatics in our practice, we should also be aware that there are rules out there that are meant to guide us and protect us from abusing this privilege. Also, another rule or law that actually applies and checkmate our practice of nursing is the Nurse Practice Act, referenced on this video as well. And this Nurse Practice Act is available in every state. Every state has its own Nurse Practice Act, and this is being enacted by the State Board of Nursing. That's why when somebody malpractices, the State Board of Nursing can withdraw the person's license. So with this Nurse Practice Act comes the scope and standard of practice. It tells us what is within our scope of practice. As a nurse, I have things that I'm not qualified to do yet, but a nurse practitioner, somebody with a higher degree, might be able to do it. And there are some that I do that somebody with a less degree than mine is not permitted to do. So when we know the Nurse Practice Act, it will guide our practice. We'll know what we are supposed to do and how we are supposed to do it the best way possible, with the patient's best interest at the center of our decision. So we have to be aware that there are rules out there to guide us. And when we know that those rules are there, we avoid compromise and stand by compliance. So that at the end of the day, these rules are not out there for no reason. They are there to protect the people we serve, who are the patients. Okay, so when we are aware, we will know the best way to do our job and to prevent causing problems for ourselves. And with this, I believe that you have learned something from this topic. Thank you for being there and thank you for your time. Bye.